Welcome to today's press briefing. With us are two medical doctors, Dr. Albert Au, Principal Medical and Health Officer, CHP, and Dr. Sarah Ho, Chief Manager and Hospital Authority. The two doctors will bring us up to date on COVID and Hospital Authority. Dr. Ho, please. There are 2,690 patients, COVID patients in hospital, and 292 are new admissions. For those in the isolation facilities, the number stands at 471 in isolation wards, 175 in second-tier isolation ward, 518 in North Lantau Hospital ICC, 227 at AWE Treatment Center, 199 newly admitted patients. We have reported 13 patients in critical condition, 7 serious. For those in hospitals, 56 are in critical condition, 54 in serious condition. 16 of the critical patients are in ICU for treatment. For the deceased patients, we have reported 16 cases, 9 male and 7 female, ranging in age between 4 and 98 for the 4-year-old. This is a boy in Truman Hospital. 10 are unvaccinated. For the diseased patients, one of them is younger, and this is a 56-year-old patient. The patient is cancer-stricken, which has metastasized, and the patient is undergoing some palliative care, and once infected with COVID, the condition deteriorated and the patient passed away. 348 patients have recovered, 310 have been discharged. Today, we don't have any patient picked up during admission screening. For staff members, 93 staff members have come down with COVID, and another 38 staff members have returned to their posts. I hand you over to Dr. Au. Thank you, Dr. Ho. I report the COVID situation yesterday on the 16th of September. Locally acquired cases 8149, 1878 picked up through PCR, 6271 through RAT. 129 imported cases were reported, 122 through PCR, and 7 through RAT. There are 16 deceased cases as reported by Dr. Ho. As of now, since the 5th wave, we have registered 9655 cases of fatality. Of the 129 imported cases, 52 were picked up at the airport, and 37 were picked up at the quarantine hotels or quarantine centers. The remaining 40 were picked up at the community testing centers. 33 day 4 to day 7, the remaining 7 beyond day 7. Of these 129 imported cases, they come from 34 countries. 2 countries have reported more than 10 cases, the US 20 and the Philippines 18. The remaining 32 countries have reported 10 or less than 10 cases. There are 3 care homes that reported COVID positive cases. There is an RCHE involving 3 residents. One involved 2 residents, and this one is in Chunwan Caritas JC Yan Fai Yun Care Home, and there are 2 RCHDs involving 2 residents. And they are in Saigon Christian Family Service Center, Tree Lam Center, and also another one in Yunlong Hong Tai Jiga Care Home for the Disabled. There are 10 residents who are listed as close contacts subject to quarantine. For schools, today being a school holiday, we have received no reports. As of yesterday p.m., we have received some reports involving 10 schools with some individual classes that saw clusters and revised classes be suspended. And for these 10 schools, there is one class each. Each class involved 2 to 4 COVID cases, and there were 5 KG come CCC and 3 primary and 2 secondary schools. For subvariants, the PH lab conducted the test, and 82.1% of the cases tested positive to L452R, lower than the 84% yesterday or earlier. The latest figures show that for L425R samples, majority of them are BA5, and they make up 92.3%, and remaining 7.7% are BA4. For BA5, it takes up about 75.8%, BA4 6.3%, BA.2, 12.1, 3.4%. The remaining are BA.2, 14.5%. That's all I have for the time being. It's now time for a question. Please identify the organization you represent, please. Any questions? The one at the back, please. Doctors, now TV. There are many international events, like Standard Chartered Marathon, that have been cancelled. In terms of the COVID situation, is it feasible to organize these international mega events? Are there any risks? And also the aligned vaccine pass between 5 and 11, vaccine pass is going to be implemented for them. There are some suggestions that this is unfair to the children in Hong Kong. How does the CHP view this? Now, the arrangement will be aligned now, but why is it that there is still inconsistency in terms of implementation and also the surveillance? What is the latest trend, and do you have any particular figure compared with a week or so before? And also in terms of the caseload, we haven't seen any rebound, 7 days since the Mid-Autumn Festival. Have you seen the actual figure, or are we really hitting a plateau now? Thank you very much for your question. Will you repeat your second question about the vaccine pass? Yes, the provisional vaccine pass below 11, those arrival below 11 will enjoy exemption, but for 5 to 7 years of age in Hong Kong, there will be vaccine pass implemented on them, and this is not fair to them according to some perception. And there is this inconsistency. How are you going to address these inconsistencies there? Right, thanks very much for your question. And let me deal with the trend of COVID. Locally acquired cases over the past 7 days has been hovering around a stable level below 9,000, basically between 70667 and 8904. I mean, the figures vary from day to day, but compared with mid-August or early September, where we saw a rapid rise, the situation has stabilized a little bit. We were concerned earlier that following the Mid-Autumn Festival, during which people are having a lot of activities, will there be any rebound? It's been a week since, and we're looking at the numbers. We haven't seen any specific or dramatic rise in terms of number. I think we have to leave it a couple of days or a week before we can be certain whether we are hitting a plateau or whether we are witnessing any decline, but we're not sure at the present moment. As to international events, the Hong Kong government has a mechanism to risk assess the situation. If there are any organizations that want to organize mega events, they can put in an application, and we will be making risk assessment having regard to the COVID situation. And we would offer advice to the organizing party to implement anti-COVID measures. As to the provisional vaccine pass, yesterday the Health Bureau has already issued a press release explaining the latest arrangement in this regard. And I'm sure that the government will be reviewing the policy on a regular basis. Between 5 and 11, children between 5 and 11, they may not find it so easy to get vaccinated, so we don't have this arrangement for the time being. In terms of sewage surveillance, looking at the numbers, over the past week, we have seen a decline. Earlier, at the beginning of September, the samples from the sewage surveillance, the viral load per liter was 500,000 to 600,000 copies, but over the past week or so, it has come down a little bit to something like 400,000 to 450,000 copies. We will be seeing whether this has stabilized.
Next question, the lady next to the journalist. I'm from Cable News. A question about the vaccine pass, the provisional vaccine pass. Now, people have to get the third jab within 180 days after getting the vaccine pass, but the Hong Kong citizens only have a shorter period, like 2 months. Why not align these two periods? Some experts argue that if in the next 2 weeks we have fewer than 3,000 cases reported per day, we will have the conditions for further relaxing our social distancing rules. Given our circumstances, are we in a position to further relax the restrictions? 2 health clinics offered expired community vaccines to people. How are the affected citizens doing? Has there been any follow-up on their condition? The last question. Professor Lo Chongmao argued that to reopen, we will have to ensure that our public healthcare system can cope with the infection levels. For the hospital authority, for public hospitals, if there is further relaxation in social distancing rules, will there be a major risk for our public hospitals? Thank you for your questions. The first question is about the temporary vaccine pass, the provisional vaccine pass. Last night, the Health Bureau put out a press release detailing the latest arrangements. The 2-jab rule under the vaccine pass, we want to align things so that inbound travelers need to be double jabbed to get the provisional vaccine pass unless there are exemptions or grounds for exemptions. For the community vaccines, the case about the expired vaccines, we put out a press release yesterday. The day before yesterday, we received a report from a clinic. It's a place in Central and Taikoo. It's called EC Healthcare, involving 2 clinics. From July 26 to sometime in September, 45 citizens were given community vaccines that were past the use-by period. We conducted a series follow-up actions. We inspected the 2 clinics and also made recommendations and reminded the staff there to separate the vaccines separately based on the use-by date. And they also have to check the use-by date of the vaccines regularly. They should also follow the Department of Health's guidelines in disposing of expired vaccines. We have done a preliminary assessment and advised the clinics to improve the management of vaccines and internal communication to prevent such incidents from recurring. In terms of the vaccine efficacy and safety, we have also checked with Fosun Pharma, and we heard from Fosun that nothing suggests that the use of vaccines after the use-by date would lead to adverse effect. We have also consulted our local experts. Our preliminary conclusion is that these affected people will not have to get another shot. Now, second question about the social distancing rules within the government and at the panels or expert panels headed by the chief executive. These people have been examining the local COVID situation. The chief executive and the secretary for health have made remarks on multiple occasions saying that in terms of our COVID policy, we stick to a number of policies. First, we have to bring infection numbers under control, minimize the number of severe cases, deaths, and protect the vulnerable. And we also take targeted approach based on science to identify high-risk groups and manage the number of people We also balance the risks and economic activities. I believe the government will stick to these five principles and review our measures from time to time in terms of the social distancing measures. Now, the third question, we will hear from Dr. Sarah Ho on that. Now, for the hospital authority, on August 23rd, we activated our phase 3 bed mobilization plan at different public hospitals, including the North Atlanta Hospital, Hong Kong Infection Control Center, and Asia World Expo. 2,500 to 5,000 hospital beds have been set aside for COVID patients. Just then, as Dr. Albert Au said, after the Mid-Autumn Festival holidays, the infection numbers did not show a dramatic rise. For infection numbers, there's also a slight drop. Every day, the newly admitted COVID patients are still at a high level, roughly 300 patients or so. We will continue to monitor the overall situation and the bed occupancy rate. We will maintain the mobility in our deployment in adjusting our services and deploying hospital beds to care for patients with different needs. Next question at the front. I'm from Ming Pao. The first question for the CHP. A mainland study released today argues that they use data from the South Africa, the US, and Canada, that although Omicron is more transmissible than flu, but the fatality rate is lower than flu. So they described Omicron as a more powerful form of flu. As the study suggests, public measures addressing flu will be enough to deal with Omicron. Given that, should we be relaxing our social distancing measures? Over the past week, for L452R, they're taking an increasing proportion, but that proportion has dropped today. Why is that the case? Where will these figures be going? Is that something related to stabilization of the COVID situation? A question for the HA. This morning, Professor Lo Chung-Mao argued that his plan is to resume hospital authority services up to 80%, but now we're only up to 60% in terms of resuming our services. Where are we at? What services will be resumed first? What measures will there be to lower the occupancy rate, such as taking fewer patients or relaxing discharge rules such that more resources can be freed up to resume the services? This morning, Professor Lo also mentioned that this year, the fatality numbers are higher than the 2019 figures by 6,000 to 7,000. He mentioned that this has to do with the reduced services at hospital authority. How many such people are there? Does the HA know? Have you compiled the stats that people who are dying indirectly due to COVID as a result of the adjusted services, will the resources, since resources are given to COVID patients, will that lead to delays in treatment for non-COVID patients, leading to more deaths among non-COVID patients? Thank you for your questions. The first question, the mainland study you mentioned, I'm not sure which study you're referring to. That hasn't come to my attention. Over the past few days or past the whole period of time, many experts or different people that have compared COVID with seasonal flu. But we should be mindful of the fact that flu is an endemic that has been with us for a long time. It's a common disease. It's a seasonal thing. Take H3N2 as an example. That has been in existence since 1968. For H1N1, it has been around since 2009. Most people have had repeated infections, or some have had the flu shots, and that's how they got their protection from. And for COVID, it's something new. It's still in the pandemic form. Comparing COVID with the flu, the data shows that COVID is more severe than flu. The local data shows that the fatality rate is higher for COVID. And for Omicron, the fatality rate from the beginning of this year up to now the fatality rate has shown a marked decrease. That's something we have seen. But the reason for that is that in Hong Kong, vaccination rate has gone up compared to what we saw earlier this year or the year before. And for the seniors, the latest figure for those in the care homes, more than 70% of the residents are triple jabbed. That protects them from COVID. Now we also have oral antivirals for COVID. The third reason is that we also have other control measures, infection control measures, and for close contacts at care homes, they will also be sent to quarantine centers so that they are monitored. If they are infected, they can be identified early on and medication can be given. All these measures they help lead to this drop in the fatality rate of COVID. But can we really compare COVID with flu? That's not the case yet. For COVID fatality rate, seniors are still at a higher risk of fatality, and there's no question about that. Vaccination also makes a huge difference. At previous press briefings, I gave you the figures. To treat COVID as something milder, we will have to boost the overall immunity in the community, especially for seniors and the younger children, but we haven't come to that point yet. The second question for the L452R cases, it's not a drop yet. The figures fluctuate from day to day. We have to monitor the situation to see whether the L452R cases have peaked. Roughly over 80% of the cases still test positive to L452R, most of them being BA.5 cases. We will continue to monitor the situation. The increase has slowed down and may have peaked. Now the third point, the fatality figures, we will hear from Dr. Ho about that.
As to the trend of COVID, we are monitoring the situation. We said earlier that we're going to have the real name system, and we're going to have the flexibility to increase the number of beds. If there is any easing of the COVID situation, we do have the mechanism to redeploy the hospital beds and also bringing other services back into service to look after the patients. As to the fatality, we do have an expert committee looking at the cases. So we'll look at the underlying conditions, the vaccination status, whether there has been any resuscitation and so on. We would be looking at the cases individually. That's it for today. Thank you all very much.